Okay, guys. So we are quickly going to look at they said that classify using syndromic approach. STIs, that's the sexually transmitted infections, then STDs, these are the sexually transmitted what diseases. Right? Just classify them using syndromic approach. Like this syndrome of this place, this syndrome of this place, and all of that. You get. So we said that the syndromic approach to managing sexually transmitted infections and sexually transmitted diseases just simply involves diagnosing and treating infections based on how they present with signs and symptoms. Like when they say syndromic is more of like like something has a lot of signs and symptoms. So you now classify all of them together. Okay, so that's just it. Okay, so you just want to treat the disease based on the symptoms that it presents with. Okay, so moving forward, we say that this method is particularly useful in settings where laboratory diagnostics are not readily available. So you're just this depending on the signs and symptoms, right? So how the urethral discharge syndrome. All right. So this one, there's urethral discharge, there's dysuria. When the patient ease themselves, there's pain. All right. Common causes are gonorrhea, chlamydia. Okay. The vaginal discharge syndrome. We say that these symptoms include abnormal vaginal discharge, there's itching, there's dyspareunia, all right, dyspareunia. Okay. That one is pain during sexual intercourse. So causes could be bacterial vaginosis, trichomoniasis, candidiasis, right? The genital ulcer disease. This one does include genital sores, ulcers. Common causes could be syphilis, right? Um, Genital herpes, chancroid, and all of that. Then, okay, these are some examples of this. Then for lower abdominal pain syndrome, this one is just symptoms is there's lower abdominal pain and tenderness, right? Pelvic inflammatory disease, ectopic pregnancy can also be that, and erectile syndrome. This one there's anal discharge, anal itchiness, pain, and all of that. Okay, so I looked at vagina, genital, urethral, and erectile, lower abdominal pain, and scrotal swelling syndrome. Down there's swellings in the scrotum, inguinal swelling syndrome. Down there's swelling and pain in the groin. Okay. Common causes are what? Lymphogranuloma venereum and bubonic plague. Okay. So you guys, that's it for you trying to use syndromic approach. Um, Classification of STIs and STDs using syndromic approach.